New tonight, there is a move to take away the FDA's authority over food and give it to a brand new agency that would aggressively test for contaminants and work to keep products safe. As senior investigative reporter Lisa Fletcher reveals, in the wake of 2 infants dying from bacteria in their formula, heavy metals lingering in baby food, and hundreds of toddlers being poisoned by lead in tainted applesauce, the FDA's failure to take decisive action has some members of Congress looking for a new approach.
There is this failure on behalf of the FDA.
Because the FDA does not have our back.
It's something we've tracked for years.
FDA needs and must do more.
This is unacceptable, completely unacceptable.
The Food and Drug Administration, tasked with keeping our food safe, failing to take decisive action to protect public health. From neurotoxic heavy metals in baby food and applesauce to deadly bacterial outbreaks in infant formula and on lettuce that killed at least 8.
This is about saving lives. This is about saving lives.
Representative Rosa DeLauro, who's been in Congress for more than 3 decades, has had enough. She's introduced legislation to remove the FDA's food authority and start fresh with a new agency, the Federal Food Administration.
How serious is the problem when you have to put forth legislation to dismantle part of an agency in order to create a new one to protect public health?
The Food and Drug Administration, the FDA, has jurisdiction over drugs, tobacco, devices, and food. The food safety portion of their mission is often, secondary to everything else that they're doing.
We've long been told by experts that part of the problem is the FDA's unwillingness to disrupt the business of food, instead being too protective of industry status quo.
Is there a way in trying to create this new agency that you can somehow ensure that it doesn't have the kinds of ties to industry that have been a great concern of those observers of the FDA and its lack of action with industry when there's a problem?
The industry should not be driving the direction or the mission of the FDA. That should not be the case. There has to be a regimen, there has to be a protocol, there has to be requirements. Industry needs to be accountable.
New accountability in the form of an agency with the power to recall dangerous food items quickly and the funding and staffing to carry out inspections.
How realistic do you think it is that this is going to get traction and move forward and we may see the creation of this agency?
I never give up, and I never want to take no for an answer. One of the biggest issues with taking the food piece out of the FDA is turf, which is a very, very big problem in Washington, D.C. Everybody wants to hold on to as much as they can.
But when they're holding on to a system that's failed, DeLauro says she's happy to explain why things need to change.
No one wants to go into that grocery store, buy something, bring it home, and have their child either get sick or maybe die.
Despite years of asking, the FDA has never agreed to sit down and do an interview with us. The agency told us it does not comment on proposed legislation. It has promised, however, to set final limits on lead in baby food by the end of this year, although the agency has missed its own deadlines in the past. Lisa Fletcher, 7 News.